So happy Friday, and thanks for agreeing to spend a little time with us today. My name's Dee Dee Hill. I am Policy Director at the Schuyler Center for Analysis and Advocacy. And for those of you who are not familiar with us, we have been doing the work for 152 years. And for all that time, we have been advancing data-driven, effective policy proven to improve the well-being of disenfranchised and low-income New Yorkers, with a real focus on children and families. We are excited to spend some time with you today to share with you our take on where things stand right now with New York State budget negotiations. And our focus today is going to be on the issues that are most critical to the health and well-being of low-income families and children and New Yorkers living on the margins. And so I'm gonna talk about where we are right now in. Oh, and here are our presenters. Sorry, just trying to keep up with the slides. In a few minutes, you're going to hear from different members of our team, and we're going to talk about, some of the areas of the budget that we are paying real attention to. So let me tell you about where we are in the budget process. And I know that many of you on this webinar are very keenly aware of this, but let's do just a little bit of level setting. The New York State budget process officially began in the middle of January when the governor released her executive budget. And then there were hearings and lots of discussions about what was in that executive budget, what was good, what might be missing. And then about 2 weeks ago, the Assembly and the Senate, they released their responsive budget proposals. We refer to them as the one house budgets. And now we are in sort of the final throes of negotiations. Officially, state leaders have until April 1st to reach an agreement on the final budget. Admittedly, sometimes that April 1st deadline slips a little, sometimes it slips a lot. I know that for those of us who are sort of living, breathing budget, I think we can maybe all come together and manifest that the budget will be done in the next 2 or 3 weeks. But we will see. So our plan for today, as I mentioned, is that members of the Schuyler Center team, we're going to give some high-level updates on where things stand with some of our top priority areas. We're going to aim to keep our remarks to 30, maybe 35 minutes. And then we're going to open things up for questions. I'd urge all of you, as questions come up, please throw them into the chat, and we will do our very best to answer them. We are also going to be referencing action steps that you can take with us to influence the final budget negotiations. I think, we're all keenly aware that this state budget is being negotiated against the backdrop of federal lawmakers who are actively advancing proposals to cut long-standing programs that are proven to support families, seniors, individuals with disabilities, proposals that, consider cutting programs like SNAP, Head Start, Medicaid. And I think against that backdrop, it feels more important than ever that our New York State budget reflects our New York State values. And for us at Schuyler Center, that means prioritizing robust investments in policies proven to set up children and families to thrive. And we mean all children, all families. We mean policies that are inclusive, comprehensive, and intentional about advancing racial equity. So please keep an eye on the chat for links to ways that you can take action with us to influence these final budget negotiations, so that we can really end up with a just budget, and a budget that centers New York children and families. All right, so with that, I am going to turn things over to Kari Siddiqui, who's going to kick us off.
Thanks, Dee Dee. And good afternoon, everybody. Like Dee Dee said, my name is Kari Siddiqui. I'm a project director at Schuyler Center, where I focus my work around our child poverty reduction efforts. So I'm going to take us back just for a moment before jumping into budget to talk a little bit about the moment that we're in, which is really kind of an extraordinary moment of opportunity to make a real difference on child poverty rates and the lives of children in poverty in New York State. So backing up just a little bit, in 2021, the New York State Legislature passed, and then Governor Hochul signed into law the Child Poverty Reduction Act, which commits the state to reduce child poverty by 50% by 2031. As part of that act, it also established the Child Poverty Reduction Advisory Council, which is tasked with measuring the state's progress towards that goal, and releasing recommendations to help the state achieve that goal. And this past December 2024, the council released a strong set of recommendations that would help the state, New York State, achieve its child poverty reduction goal. And those recommendations include what are on your screen here, which are a significant expansion of the child tax credit, which is proven to be one of the most effective ways of addressing child poverty. An establishment of a housing voucher program, as we know that housing is one of the major issues faced by families living in poverty, and 100% increase in public assistance basic allowance, so that assistance for the lowest income families. And then finally, the creation of a state food benefit for families who are excluded from the federal SNAP program. So the release of these recommendations, like I said, really marked an opportunity for the state to take some real, concrete, significant steps to enact policies that will have a meaningful impact on child poverty rates here in New York State. And we've seen, if we can go to the next slide, please, some commitment to this work on behalf of both the governor and the legislature. In January, the governor included an expansion of the child tax credit in her executive budget proposal. And that proposal, if passed, would be the largest expansion of the credit since its establishment in, I believe, 2006. And it is a broad-based proposal that would reach both our lowest income families and middle income families, and would extend the credit to families who are currently excluded from the child tax credit due to their low income. So the tax credit currently includes a phase-in requirement that excludes the lowest income families from receiving the full benefit. So this was an amazing starting place, but not as strong as the recommendation from the Child Poverty Reduction Advisory Council, and was an opportunity for the legislature to build upon it, which both the Assembly and the Senate did. They both took the opportunity in their one House budget proposals to build upon the governor's proposal, and they both include variations of the Working Families Tax Credit in their budget bills. The Working Families Tax Credit essentially encompasses everything that is in the governor's proposal. So it increases the amount of the credit, it brings in those lowest income families, and it makes it even more impactful by combining it with the earned income tax credit, so that families would actually reach $1,600 per child per year when it was fully phased in. And that includes children ages 0 to 18, excuse me. So we're very excited about that and think that that is a real opportunity to begin to address child poverty here in New York State. A couple of other things that are in the one House budget bills that we hope to see in the final budget and are reflective of the Child Poverty Reduction Advisory Council's recommendations. One is the Housing Access Voucher Program. While that was not included in the governor's proposed budget, both the Assembly and the Senate included $250 million in their one House bills for the Housing Access Voucher Program, which is very reflective of the Child Poverty Reduction Advisory Council's recommendation around housing vouchers, and would create a state program similar to Section 8 that would provide housing vouchers to help address housing crisis for many New York families. Additionally, both the governor and both houses of the legislature include full funding for universal free school meals in their budget proposals. And this would have, as I'm sure you can imagine, a tremendous impact on the lives of children and families, and is estimated to save families about $160 per child in food costs, and helps to minimize stigma in the school cafeteria. Also around nutrition supports, while the Child Poverty Reduction Advisory Council's recommendation around the creation of a state food benefit was not included in either of the one House budget bills, there was legislation recently introduced that mimics that proposal, that is SNAP for All, and that's Assemblymember Gonzalez Rojas bill, and it creates a very similar program to what is recommended by the Child Poverty Reduction Advisory Council. And I do want to mention that the Senate does include a proposal in their one House bill to establish a state minimum SNAP benefit. So currently, the minimum benefit that families can receive is $23 a month, which, as you can imagine, does not go very far for food costs. And so while the ask had been $100 state minimum benefit, the Senate includes a proposal for a $50 minimum benefit, which is a step in the right direction. And then around public assistance, missing from all of the bills is really a meaningful increase in the expansion of public assistance benefits. As I mentioned earlier, the Child Poverty Reduction Advisory Council proposed or recommended, excuse me, a doubling of the basic allowance for public assistance. This is the money that folks on public assistance receive monthly to help make ends meet, and is very low levels. So the council had recommended a 100% increase. We have not seen that in the one House bills or in the governor's proposal. We think that that is incredibly important. I do want to mention that the Senate does propose to expand that assistance for a very specific group of people. So those individuals living in shelter, and a shelter that specifically provides them 3 meals a day, would receive a pretty significant increase to their allowance. However, these folks have been receiving $45 a month since 1997. That number has not increased, so they were long overdue for that increase. And we believe that that is the kind of increase that we should be seeing across the board for cash assistance. And then I also want to mention a proposal called the Baby Bucks Allowance. And there's a version of this in both one House bills, which is built off of a proposal that was in, or related to a proposal that was in the governor's budget, that would provide a direct cash transfer to families during the last several months of pregnancy and the first year of a child's life. And this is really intended to bolster families at a time when they're in transition and, facing the instability of, added expenses of raising a child, and have these kinds of programs have been shown to be very effective in supporting families. So we are very supportive of that as well. And I just want to end by saying that, with all of these things, I think we see a lot of opportunity in both the governor's budget and in the One House bills for some real substantive work around child poverty reduction. I think we have a real opportunity to make some investments and initiatives that would bolster and support New York's children and help to make New York State a more affordable place to raise a family. I'm really eager to work with all of our partners on this call and elsewhere to make sure that we see these initiatives in the final budget. And I'm going to pass it back to Dee Dee to talk about childcare now.
Okay, yep, I'm back, and I'm here in my role as policy director at the Schuyler Center, but I'm also wearing my hat as one of many leaders of the Empire State Campaign for Childcare, which is New York's campaign for universal childcare. So yes, here's where things are with childcare, and it's a little bit bittersweet. In the last month or so, sort of right in the middle of budget, data has emerged showing that New York's child care assistance program is growing at a faster pace than expected. And it's growing so fast that many counties around New York State, starting perhaps with New York City, they are running low on child care assistance funds. And just for background, child care assistance, sometimes it's referred to as subsidies, sometimes it's referred to as vouchers. It's the principal means by which New York State supports lower income families to afford the high cost of childcare. For families able to access childcare assistance, the state covers almost 100% of the costs of childcare. And this is an amazing life-changing benefit for the families able to access childcare, given that childcare costs on average $18,000 a year for one child in childcare, and that's on average. It's much higher in many communities around the state. In recent years, New York State has dramatically expanded child care assistance. It has increased income eligibility, up to 85% of state median income, and that's about $108,000 for a family of four. And due to these expansions, tens of thousands of families have become newly eligible for child care assistance. And all of this is amazing. This is, what advocates, what parents have been asking for years, and we are thrilled. But as I said, we are facing a shortfall. New York City is predicting that without significant additional funding in this budget, they are going to have to halt new enrollment in their program as early as April. And because they serve so many families, they anticipate that means they will be turning away 4,000 to 7,000 families every single month. Some of these families will be new enrollees. Maybe they just had a new baby and are looking for childcare so they can go back to work. Maybe their circumstances have changed and they are eligible for assistance. And many of these families are actually also going to be up for recertification. So that means that they've been receiving childcare assistance perhaps for years. They have a program that they've used for years, and they're going up as they must do each year for recertification. And while they're still eligible, will be denied ongoing assistance because of lack of funds. The disruption of these denials, it really can't be overstated. Families will either have to come up with $1,500 a month or more extra, like a new bill, on top of all of the other bills, to try to stay in childcare assistance, or they'll have to disenroll their child and come up with another plan, or they'll have to step back from the workforce. And childcare providers, they will also be impacted because they will have families, maybe families who they've served for years, have to disenroll from their program, and they will be left scrambling, trying to find new families quickly, because childcare programs operate at very thin profit margins. They need to have every seat filled all the time to keep things going. I will also underscore every day, just this morning, like new data is coming in. This is not just a New York City problem. Other counties around the state are starting wait lists, are closing enrollment. Just learned of a new county this morning. So this is happening. And it's really somber, worrying news. I will say there's some good news hidden in this news, which is New York State is providing childcare assistance to more families than ever before. And this is, we are in real time moving toward the goal of many advocates and our New York state leaders of achieving universal childcare in New York State. The governor, in her State of the State address, to a standing ovation, announced, publicly and with real enthusiasm that she is determined to achieve universal childcare in New York State. And so we are moving in that direction. It just perhaps a little faster than was anticipated. The moment we are in right now is that our state investments, they have to keep pace with this growth, or we are going to be in a position where we're just pulling the rug out from under families and childcare programs. Families who may finally be achieving some economic stability, and we just can't let them down. So here's where we are on this issue in budget negotiations. So first of all, the executive budget, and perhaps because some of this information is really very recently coming to light, the executive budget, the funding for the Child Care Assistance Program that is proposed in the executive budget is level with last year's funding. The Assembly proposes to add about $212.5 million more. Unfortunately, even that addition does not come close to meeting this growing need. The latest data that we have, and like I say, this is sort of changing in real time, is that what's needed just to hold steady in New York City and prevent wait lists and closing of enrollment is more than 800 million. And again, we're also now hearing that there is growing need in the rest of the state. The Empire State Campaign for Childcare and Schuyler Center, we've been asking for at least $500 million in the final budget to be on top of what is in the executive budget. And I'm going to, again, underscore the at least part because because 500 million isn't going to really meet need, but certainly that would be a start. And then there is the issue of the child care workforce. The Empire State Campaign for Childcare and Schuyler Center is urging and the inclusion of at least $500 million to create a permanent child care workforce pay equity fund. The Senate One House budget included this investment. This is critical. The childcare workforce is among the lowest paid occupations in New York State. These persistently low wages, they have contributed to what is a really severe workforce shortage, and this workforce shortage has worsened the state's capacity shortage, with families with the need for childcare growing at a really fast clip, as I've just discussed. We need enough workforce to make sure that we all programs can operate at full capacity so that we can meet this need. So the only way that we're going to keep moving forward steadily towards this goal of universal childcare is if we see additional investments in this final budget of, again, at least 500 million for the Child Care Assistance Program and at least 500 million for the workforce. And please click on all the links that Hannah has been putting into the chat. We really all need to raise our voices together, and thank you. And I am going to turn things over to my colleague, Crystal Charles, to talk about child welfare.
Hi, good afternoon, everyone. I'm a senior policy analyst here at Schuyler Center, focused on child welfare and child poverty. And the first piece of the budget that we're excited to talk about today is the Child and Family Wellbeing Fund. This fund came together as a response to some of the issues raised kind of earlier by my colleagues. So child poverty, food insecurity, lack of access to childcare. These are often the things that bring families to the attention of the child welfare system, child protective services, and research is coming out that when families do have access to these supports, they do not come into contact with child protective services. So the Child and Family Wellbeing Fund would direct state funding into communities, specifically those who have been historically highly involved with child protective services. These communities also happen to be communities that have high child poverty rates as well. And community members would have a leadership role in which local organizations receive state funding. So these organizations would be the trusted local groups that families already interact with. And the Wellbeing Fund would support these groups, programs, initiatives by providing funds that they are currently too small to have access to. So the traditional state grant making process is typically received by larger organizations that have the capacity to apply for these grants and do the reporting. So the Child and Family Wellbeing Fund is relatively innovative, though there are other projects like it in other state agencies right now. So we're also excited to share that the Assembly has proposed what they're calling the Communities Helping Improve Lives Daily or Child program, which is structured very similarly to the Child and Family Wellbeing Fund. So we're very excited about that and hope to see a version funded in the final budget. We're also really excited to celebrate the Foster Youth College Success Initiative's 10th year. This program provides support to college students that have some experience being placed in the foster care system in their past, or are currently still in the foster care system. And it helps provide some of those a little more informal supports that traditional financial aid might not provide for. So this initiative has been found to actually help students graduate with their associate's degrees and bachelor's degrees. And full funding for this program would be $10 million. The governor proposed 7.9 million, and this year the Senate proposed full funding for the Foster Youth College Success Initiative, which we're very excited about. The Assembly also added some funds in their budget proposal. But for this year, we're looking for that full $10 million of funding in the final budget. I will leave it there for now because I know we're kind of running low on time, but you'll see in our links and other documents the other priorities that we have in the budget as well. And for now, I will pass it to Bridget.
Thank you, Crystal. I'm Bridget Walsh, Senior Policy Analyst for Health and Public Health at the Schuyler Center, and I'm just going to go over a couple of health items in the budget that we have been following. Many of you know that we have a strong interest in children's oral health issues and been working on this issue for a long time. We are particularly interested in the impact that poor dental disease has on the health and development of young children. And we've been trying to advance a number of initiatives for a few years, and we became aware that what we really needed to do was deal with workforce issues before we could make advancements on some of the things we were trying to do. So last year, we embarked on a project with stakeholders and consumers to develop recommendations to strengthen the oral health workforce to provide both better access to prevention and treatment services. We released our report in February, and that's on our website. There, they just dropped the link in, along with a lot of other resources on the project. And one of the recommendations of that report is allowing dental hygienists to provide services in additional settings when they have a collaborative agreement with a dentist. One of the reasons we're particularly interested in this is the fastest way to get more services out into communities is to utilize providers who are already working, both dental providers and primary care providers, to do additional oral health services in more settings. So this one has been a particular interest to us. This would mean that a dental hygienist that meets certain criteria could then provide preventive screenings, prevention, screening services, and referrals back to dental care in places like nursing homes, mental health clinics, domestic violence shelters, and they can provide these services without needing to have a dentist directly on site. There's a brief on this as well that they just dropped in the chat. We mentioned this today because the governor had proposed language in her executive budget, language that was removed by both houses and when they took policy out of the budget, along with other provisions. We would like to see this back in the budget, but if it doesn't, we're supporting legislation that's almost identical. They dropped the support memo in there, the Senate 3157 and Assembly Bill 2341. And also, I want you to stay tuned to our newsletter for additional activities that are going to be coming up around the workforce report and having more meetings and work groups to sort of really dig into the implementation of what was in that report. Another piece I'm going to mention quickly is early intervention program. Early intervention, many of you might know, was established to guarantee that every infant and toddler has a chance to reach important developmental milestones. New York currently ranks 50th out of 50 states in terms of the delivery of EI services. And approximately half of eligible children are not receiving their EI services on time. And we know from study after study that low and stagnant reimbursement rates are leading to therapists leaving the EI program and going to other places where they can make a higher income. So Schuyler Center is a member of the Kids Can't Wait Coalition, which is advocates and families working for improvements in early intervention. And we're advocating this year for a comprehensive review of the early intervention program, model, funding, regulations, so that we can retool the program to make it in compliance with federal law. And there was funding in the Senate, one House bill for this study, and we'd like to see funding in both houses so we can advance that report. And also, and this is critical, is the additional of an additional 5% increase to the payment rates for early intervention services. And that's in addition to the 5% that was in last year's budget. The increase was in both the Senate and the Assembly budgets. And also, we just dropped in the chat a link to a sign-on letter to the governor and your state representatives from the Kids Can't Wait campaign in support of these initiatives. The last piece I'm just going to mention really quickly, it's a legacy issue for the Schuyler Center. Years ago, before we became mostly a children and families organization, we worked a lot on the quality of life for residents in adult homes. And one of the provisions for that was this Equal program, which provides a little bit of additional funding to support improvements in the quality of life of residents that live in adult homes, both their quality of life and improvements to the physical plant in these adult homes. It's a $6.5 million program that was really critical for these homes, and it was eliminated from the governor's budget. The Assembly restored the funding. We hope to see it restored. This is important for the residents of adult homes to get things like washers and dryers, warm coats and boots in the winter, fresh vegetables, fruits, little outdoor spaces where they can get a little sunshine and fresh air in the summertime. These are really important services for a very small amount of money. And the governor also eliminated funding for the Coalition for Institutionalized and Aged Disabled, CIAD. This is the only nonprofit with boots on the ground, assisting adult home residents and understanding their rights, and having a voice in their adult home. So we're asking for a restoration of funding for CIAD that's in the budget, in this year's budget. So those are a couple of the health issues, and I will pass it along.
Thank you. Thank you, Bridget. Thank you, every member of the Schuyler Center team who just spoke. And I just want to underscore Bridget's, last ask related to the adult homes. I think it really speaks to one of Schuyler Center's strengths and what's been a motivating, like a driving motivator behind our work for 152 years. We always talk about sort of shining a spotlight on issues that too often get overlooked, often because the individuals directly impacted by a program are individuals that are without a lot of power and voice. They don't have, lobbyists. They don't have funds to sort of buy access. And that is really the residents of adult homes are among the groups in New York State with very, very little power. And to see this incredibly modest but effective program to be defunded, it's really hard, and we are so hopeful that that all of us can can lift up this issue and call for the restoration of these funds. So this is the end of our sort of formal presentation, as it were, and we would love to take any questions that folks might have, and would urge you to add your questions to the chat, and we will do our very best to answer them. And it is also okay if there are no questions. We do appreciate some of the comments we've been getting, but I'm going to just pause for another minute to see if there are questions. And if there are none, or even if there are some, I would urge all of you to read our next look. And if any questions emerge after you've read it, please reach out to any of us. We would be thrilled to have a conversation with you. I also want to urge folks again to join us in taking action. We gave you so many options, I know, in the chat for how you can, through emails or calls or other actions, elevate these really important issues, really hoping that we can work together to secure a state budget that features investments that continue to sort of lay the building blocks toward New York that is the best place to raise kids, a just and equitable place for all New Yorkers to thrive. So I think we are going to end it there, and wish everyone a good weekend, and I hope that you'll keep in touch. Thank you.